Every October, Medicare commercials suddenly take over your TV. Free flex cards, money back on your Social Security check, $0 premiums. And while some of these benefits can absolutely be real, some of these commercials are designed to get your attention long before they explain the fine print. If you've ever watched one of these ads and thought, wait, is this actually real? You're not alone. And today, I want to walk you through what these commercials are really saying, what they're not saying, and how to protect yourself from making a Medicare decision based on marketing instead of facts. First, let's talk about why these commercials suddenly explode every fall. This happens because Medicare's annual enrollment period runs from October 15th through December 7th every year. During this window, people can switch Medicare Advantage plans, change Part D drug plans, or enroll in a new plan for the upcoming year. So insurance companies ramp up advertising heavily during this season. And honestly, some of these commercials are incredibly effective because they focus on emotional triggers, free benefits, saving money, fear of missing out, urgency. And that's where many people start getting confused. But the Flex Card commercials are probably the biggest example of this. You've likely seen ads talking about grocery money, utility help, dental money, debit cards loaded with thousands of dollars. Now, here's the important part. Some Medicare Advantage plans really do offer supplemental benefits like Flex Cards, but those benefits vary by plan, vary by county, vary by eligibility, and may not be available to everyone watching the commercial. And that's the detail that often gets buried. And I've personally experienced this from the industry side too. Years ago, when I worked for larger insurance firms, people would call constantly asking for the free Flex Card or the exact $0 plan they saw advertised on television. And sometimes they become frustrated when they found out those benefits either weren't available in their area, had eligibility requirements, or didn't work exactly the way the commercial made it sound. That's why I always encourage people to slow down and look at the actual details behind the advertisement. Because the commercial may make it sound like, call now and everyone gets this, when in reality, some of the richest benefits are tied to specific plans or special eligibility situations, including certain dual eligible Medicare and Medicaid plans. So before enrolling in anything, you want to understand what the benefit actually covers, how much is actually available, what restrictions apply, and whether your doctors and prescriptions are still covered under that plan. Now let's talk about the $0 premium commercials, because this is another area where people get confused very quickly. A $0 Medicare Advantage premium does not mean your healthcare is free. And that's one of the biggest misunderstandings I see. You still must continue paying your Medicare Part B premium. And depending on the plan, you may still have copays, coinsurance, deductibles, network restrictions, referral requirements, and out-of-pocket costs throughout the year. Here's a simple example. Let's say you visit a specialist. That visit may have one copay. Then the doctor orders lab work. That could be another copay. Then imaging or testing gets scheduled. That may create additional costs under the plan. So while the monthly premium may be low, your actual healthcare spending depends on how you use the coverage. And this is why understanding the full structure of a plan matters much more than just hearing $0 premium in a commercial. But honestly, one of the biggest things people don't realize happens after they respond to some of these ads. Sometimes people think they're contacting Medicare directly when they're actually entering a marketing lead funnel. And this doesn't just happen from television commercials anymore. It also happens through online Medicare ads, social media ads, and websites asking you to check your benefits or see what you qualify for. Sometimes people believe they're contacting one company directly when in reality, their information may be routed through a marketing or lead generation system. And this is why many people suddenly start receiving repeated phone calls, texts, emails, and solicitations from multiple companies after filling out one online form or calling one advertised number. And honestly, this became one of the biggest frustrations I saw when I worked with larger insurance firms. People would fill out what they thought was a simple online form requesting information. And then suddenly they were receiving nonstop calls from multiple agents or call centers. Many of them were understandably upset because they believed they were only contacting one company. But in many cases, their information had entered a larger marketing or lead generation system. That's why I always encourage people to slow down before entering personal information online and make sure they understand exactly who they're contacting. Now, here's the good news. Not all Medicare Advantage plans are bad. In fact, for some people, they can be an excellent fit. Some plans genuinely offer strong preventive coverage, dental and vision benefits, gym memberships, prescription savings, and affordable monthly costs. The key is not to choose a plan based on a TV commercial alone. The key is understanding the network, the drug formulary, your doctors, your prescriptions, your healthcare needs, and the total potential costs, not just the headline benefits. Because Medicare decisions are too important to make based on hype. So the next time those Medicare commercials start flooding your television this fall, don't panic. And definitely don't assume every advertised benefit applies to everyone. Ask questions, read the details, compare carefully, and make sure you understand what you're actually enrolling into before making a change. If this video helps simplify some of the confusion around Medicare commercials, subscribe for more straightforward Medicare education here on the channel. And if you'd like help reviewing your Medicare options, you'll find my information and Medicare resources here on my channel. No call centers, no 1-800 numbers, just Robin. I'll see you in the next video.